Welcome, everyone. I'm Susan Stearns, and my pronouns are she, her. I'm very pleased to be able to welcome you to today's webinar. In 2008, July was nationally declared as Bebe Moore Campbell Minority Mental Health Awareness Month in order to improve access to mental health treatment and services and promote public awareness of mental illness. Mental health affects us all, and everyone should have the right to be heard and healed without shame or judgment. Bebe Moore Campbell was first and foremost a mom, and she was a mom committed to creating safe places for people in communities of color to connect with others, to share similar experiences and cultural backgrounds. These safe spaces served as a gateway to vital mental health resources and support networks. So thank you all for joining us for today's webinar, Advancing Mental Health in BIPOC AAPI Latinx Communities, Perspectives, Resources, and Action. We are grateful for today's webinar participants for their taking their time to be with us. First, our facilitator, Maria E. Restrepo Toro from the New England Mental Health Technology Transfer Center, Ali Sekou from IQRA Islamic Society of Greater Concord, our own NAMI New Hampshire board member, Nicole Sublette from Therapists of Color New England, and Lisa Vasquez, behavioral health strategist for the city of Nashua. So as was mentioned earlier, please make sure you use the Q&A for any questions for the panelists. Now I'll be turning things over to Maria to kick us off.
Thank you so much, Susan. And it's such an honor to be part of this amazing conversation. And we have enjoyed our relationship. So my name is Maria Restrepo Toro. I'm originally from Colombia, and that's how I always like to introduce myself. I'm a proud Latina from Colombia, but I've been in Massachusetts, Boston, Massachusetts for the last 35 years. So I'm an immigrant. And I've been working in the field of psychiatric rehabilitation and mental health. I'm currently working at the Yale Program on Recovery and Community Health, and I am the co-director of the New England Mental Health TTC. And this is an honor to have been asked because we are committed to this effort ourselves and are here to really support this conversation as well as to share resources that maybe join us, because this is one effort, as Susan said, that requires all of us to be together. I am really privileged to be in an amazing company of panelists for today. The first person, Ali Sekou, is a member. Ali was born and raised. He is at the IQRA Islamic Society of Greater Concord. Was born and raised in a small rural village in Niger, West Africa, immigrated to the United States in 1220, began learning English as Laconia adult education to prepare himself for higher education. Soon after that, Ali went on to earn his associate degree in hospitality and tourism management from the New Hampshire Technical Institute, his bachelor's in tourism management and political sciences from Plymouth State University, and his master's degree in Kearson School of Public Policy, UNH, in community development. He's fluent in 5 languages. Wow. He started his professional career as a manager of tourist site and later worked for the United States Embassy in Niger as a security guard. Now Lee is an assistant store manager at Hanford in Connecticut, where he oversees daily operations, serves in numerous communities boards, such as Islamic Society of Greater Concord, trustee of the Concord Library, board member of the Concord Public Library Foundation, treasurer of the Organization for Refugee and Immigrant Success, ORIS. Ali is one of 40 underboard members of the Concord Public Foundation. Ali lives in Concord with his wife, Fanta, their daughters, Samira, and son Amir. So welcome, Ali. Nicole Sublette. Nicole is therapist of color of New England. is a master's licensed psychotherapist in New Hampshire. Her services include psychotherapy, hypnotherapy, somatic treatment, neurofeedback, and integrated medicine for mental health services. She started the Therapists of Color in New England to the first BIPOC group therapy practice in the state of New Hampshire. Nicole is also a doctoral student in natural and bioenergetic medicine. She seeks to provide holistic care for mind, body, and spirit, and also strive to decolonize mental health practices. Nicole serves as a board member of the NAMI New Hampshire. Recently, Nicole won a scholarship from the Harvard Kennedy School Social Innovations and Change Initiative to attend the Harvard Business School Power and Influence for Positive Impact. She has been featured as a guest several times on WMUR, New Hampshire NPR, several podcasts, national podcasts, highlighted therapists in counseling today. Nicole has also developed cultural responsive training for behavioral health providers in the state of New Hampshire. Was able to obtain a grant so behavioral health providers could attend this training free of CEUs. Is a public speaker, and he's also done several diversity, equity, inclusion, and justice training organizations. And lastly, Lisa Vasquez, she's the Behavioral Health Studies of the City of Nashua. Lisa Vasquez serves as the Behavioral Health Strategist of the City of Nashua Division of Public Health and Community Services. Lisa has been in this division for 9 years, has a master's in mental health counseling from Southern University, New Hampshire University. Previously has worked with many local organizations, including the Youth Council, the Greater New Hampshire National Mental Health Center, Lamprey Healthcare. In addition to the current position, Lisa serves on the New Hampshire Public Association Board of Directors for 2 years. Is currently on receiving Recovery Resources Center Executive Board and facilities the City of Nashua Major Task Force on Substance Misuse. Lisa co-hosts the Public Health Hour radio show with Bobby Wangler and created a podcast titled Speaking Our Minds to Increase Mental Health Awareness. She is a Manhattan native with family roots in the Dominican Republic, which has traveled many times throughout her life. In her free time, Lisa enjoys knitting, reading, dancing, spending time with her extended family, lives in Nashua, New Hampshire, and 3 sons and a fiancé. So you are going to have an amazing time at the company of these 3 amazing guests today. Just let me, just really to emphasize the importance of these conversations today. Please know that, you know, as you know, the statistics are really heartbreaking, and we know that disparities exist, mental health disparities exist. But we really know that it's really only 1 in 3 Black adults with mental health services that actually receive care. That's very little. Black and Latinx children are about 14% less likely than white youth to receive treatment to their depression. Do you wonder about the suicide rates, right? Which in 2018, a study found that suicide rate of Black children 5 to 12 was nearly twice than the white children at the same age. Although rates of depression are lower in Blacks, and mean lower is 24.6%, and Hispanics 19.6% than in whites, depression in Black and Hispanics is likely to be more disabling and persistent. And I think we're going to be learning about why this is the case, because we're going to see the intersectionality of multiple factors that affect these communities. In 2018, Asian Americans were 60% less likely, and Hispanic Americans 50% less likely to have received mental health treatment than non-Hispanic ones. So huge number for Asian Americans, 60%. American Indian Alaskan Natives report higher post-traumatic stress disorder and alcohol dependence rates than any other group. So in order to start our conversation, and again, feel free to ask. We have wonderful collaborators behind the scene to answer all your questions to any of the collaborators. I'm now going to be inviting the panelists. And what we're going to do is we're going to be talking about the major issues that affect, and I know this is an hour's long conversation, and we probably could spend 1 hour in each of the topics. But let's start with racism. You know, we know racism and racial trauma increases the risk of people of color. We know it really has to do with post-traumatic stress disorder, and it plays an crucial role in how racism impacts both not only mental and physical health. So let's just open the conversations. We know microaggressions, for instance, are a form of racial trauma and harms any of us, people of color, when they are impacting mental health. So mental health and racism, take it away. And I can invite panelists to naturally unfold that. Perhaps for this first session, I can turn it over to Nicole. I see Rebecca has raised hand.
Thank you, Maria. I do want to address this in speaking about racial trauma. Now, racial trauma is not the same as PTSD, even though there are some qualifiers that do look very similar. However, the thing is, one of the differences is that sometimes with trauma can be one event. Repeated exposure to racism is chronic. And so there have been amazing studies regarding this. And so, for example, they have found that experiencing microaggressions can increase aging on a cellular level. Also increased risk of cardiovascular disease, hypertension, and unfortunately increased risk of suicidality. So there's a huge correlation between racism, microaggressions, and physiological health and mental health as well. And it can have a pretty devastating impact on individuals.
Thank you so much, Nicole. That's a very important, because we talk about holistic mental health, right? And it's striking the physiological side effects. Lisa.
Thank you. When talking about racism and access to services, many people don't feel that they have access to services when it comes to that specific topic. If they are experiencing microaggressions or larger forms of racism, though that's hard to say, because microaggressions over time, just the cumulative effects, as Nicole was saying, can be devastating to a person. But when people are looking for therapists, just the inability to find people who might understand or look like them, or understand that experience, because trauma is really the experience of that person with that event. And that could differ from person to person. But for many people, feeling seen, heard, and having representation within the counseling community to make them feel all those things, seen, heard, and valued in their treatment, can be hard. So there's many people that might be open to receiving therapy, but don't see themselves in therapists, and because of their experiences, that becomes a barrier for them to access services. So not just not being able to find therapists that look like them, but also once they find a therapist, being able to find one that understands and is able to talk to, or be able to deal with those issues of racism, colorism, microaggressions, is hard to find in New Hampshire. So those are barriers to people being able to access treatment.
Okay, thank you, Lisa. And I think I have two important questions, and perhaps Ali or any of you can answer, because it's very related. Both of you really talk about, especially the cumulative effect. And there is a great question about microaggressions. It says, microaggressions will have a similar impact as accomplice PTSD. So perhaps one of you can, or Ali can talk about what a microaggression is, and do these microaggressions have a similar impact as complete PTSD? And are there any difference between developmental trauma and racial trauma? So these are all two different questions, but quite related when it comes to trauma.
Hello, you guys hear me?
Yes, we hear you well.
Thank you for the introduction, and thank you for having us today here to discuss this important topic that affects us all at certain level. And when we talk about racism, I think we can look at racism in different aspects. And I'm just going to say what Nicole just shared about racism related to science, because the data that Nicole has given us shows us that racism itself in a community or in any given society reduce productivity. And I'm going as a businessman and as a community leader that lead people that come around the world. The mosque is the most diverse community you can ever meet. When you go in the mosque, you will find people from Asia, Africa, the United States, or America as a continent. But sometimes there will be 5, 6, 10 of us that are sitting, and we are all from different countries and speak different languages. But I'm going to talk about productivity in the community itself, but also at work. We all know we bring our whole self to work or to be part of a productive and successful community when we feel that we have that freedom to be ourselves. So racism reduces that productivity and reduces the community thriving, because many people have the talent, expertise to be out there and share it. But due to them being different, they are hesitant to come forward to bring those expertise that will benefit the entire community. And as you said, that can create trauma when you feel that, okay, in some ways, I'm not valued. So if you feel not valued, what can you do to make that? And people get tired of fighting sometimes because you feel this is a natural given right that you don't even feel you have. This is not even a right that is given by the Constitution, like the right to worship, the right to the freedom of speech, or whatever freedoms that we have. We are not even talking about that. But even the natural freedom given to us as individual and as human beings, sometimes you feel that freedom, you don't even have that, but we preach it all the time. So if any community or society wants to thrive, I think the inclusiveness that we have been talking about, this is where it comes to play. And I think I will stop there and answer the question about microaggression, because that's another topic that I think we can spend some time talking about. But just look at a community at itself and look at the workplace, the diversity or the inclusiveness, or not racism free, because that society doesn't exist where there is a racism free, but at least where people feel part of a team, how successful is that team and how productive is that team.
Thank you, Ali. And so I think that what I think the conversation is really starting to move, Liz, I will give this in a second too. We'll go back to the community because that's a very important topic. Let's continue with the microaggressions. Lisa, please go ahead and just respond to that. I think the clarification, if you saw it, just how do they manifest different?
I think not only how do they manifest is important because it could be similar to other traumatic experiences. You probably will see people trying to not engage with that person, that group of people. But I think one of the things about microaggressions that makes it so difficult to address is intent versus impact. Sometimes when we see microaggressions or we experience microaggressions and we confront the aggressor, there is a denial of intent of harm. But regardless of the intent, the important thing is the impact. Again, trauma is an experience. and we can't deny someone's experience. So that sometimes makes it harder to deal with microaggressions because of that dynamic of the aggressor not having the intent of harm, but the impact of harm is there. So I think that is something that, to keep in mind, that no matter what the intent is with microaggressions, the impact is what matters, how it impacts the person and how that experience of trauma is impacting the person.
I would like to add to that too and break it down a little bit more. So microaggressions are slights, snubs, and also they look as compliments that are intended to be well-meaning. So common microaggressions might be, wow, you're so intelligent for a Black person. Why is that a microaggression? Because the person saying that is acting surprised that a Black person possesses intelligence. Or in our state, which has a lack of diversity, often another microaggression is, I don't see color. And why is that a microaggression? Because it really diminishes the experiences that people of other races or disabilities or anyone that holds a marginalized or oppressed status experiences. So when we say we don't see color, that means we're denying the experience of other people. Another microaggression is, can I touch your hair? Why is that a microaggression? Because it's really an invasion of personal space. So I really wanted to break that down into some examples of what they are. And as Tulisa is saying, is that they're often intended to be well-meaning, and that's why it's very confusing. And so when it's confusing, that's called attributional ambiguity, because sometimes receiving a microaggression, I know when I have received microaggressions, I kind of have to sort that out. Like, that was intended to be nice, but internally that didn't feel really well. So there's this kind of sometimes this like mental gymnastics that I have to play out to kind of figure out like what is happening. And so these things, they say microaggressions is like experiencing death by a thousand cuts, right? Because they happen. And what happens is when we experience it over and over again, it's called weathering. And that's what has an impact on our mental health and upon our physiology, and sometimes our soul and our spirit, because it's day after day or moment after moment. And sometimes it doesn't feel like there's ever a cease or a pause or a space. And so that's why they can be so incredibly detrimental, and sometimes more detrimental than overt acts, because microaggressions can be repetitive and chronic.
Thank you, both of you. Ali, go ahead.
I think Lisa defined what microaggression is, and just to listen to what Nicole has said now too, the everyday verbal and nonverbal and environmental slights and snubs or insults that happen around and people of different background, how they feel marginalized and how they feel different. And sometimes we have to look at the intention as well. Is this intentionally done or intentionally done? Either way, it's not good, because at the end of the day, if you didn't get to respond right away, you might go home and reflect, was this person that said this, does he mean this or does he mean this? And then it creates that trauma in your mind that why shouldn't I, or why didn't I say something while we were together? So literally microaggression is very, she said it, ambiguity in it, because it's hard to define. It can be a verbal and non-verbal. So it's now up to us to educate those people, to take the time. If you find that, okay, it's done unintentionally, what can I say here to make it easier going forward so that they know these are not things that are acceptable? And the common word used here is like, I don't see color. So how can you respect or value or even cultivate that inclusiveness that we are talking about, even representation, when you don't see color, or when you don't see national backgrounds, or when you don't see people as different in that sense? So it's a very complex word here, because microaggression can be the verbal and the nonverbal, the intentional or the unintentional. So hard to define, hard to see.
Thank you to all of you. And I have said that as a woman of color as well have experienced microaggressions. I think one of the things that I do want to point out is when we have, and I'm glad that this was brought as a part of the racism, because this could also help move this conversation into a good initial step in having this conversation about microaggressions more intentionally, because there's also microaffirmations that one can actually continue. So that pain, even though it was unintentional, I get lots of those about accents, right, personally, and even my own nationality. Oh, Colombia, oh, drug cartels, like so. So, and there's somebody on the chat that's saying, yes, unfortunately, there's a lot of microaggressions happening. So that the important thing is, I think, trauma, as I hear the panelists, is something individualized, and we need to honor, especially when we're doing this work in these communities, that we need to honor that whatever histories of trauma are presented, this is has a huge impact on the work we do. So I think that Melissa has a question about how the trauma then, is it all merged together? Because I guess Melissa clarified, she understands there's developmental trauma versus racial trauma. I know that research shows that, sometimes people of color have even more developmental trauma. We definitely know the access, imprisonment, incarceration, all those kinds of things. So would any of you would like to comment a little bit in how, is there a way that we can differentiate that trauma, if any, at all?
I think what I want to say here about the other trauma, if we move on to the racism part of it, is the accessibility. We have resources available, but some communities, due to them being marginalized or them not even knowing those resources are available to them, how can you seek for something that you don't even know it's available? So I think accessibility is key here in this specific trauma, because people are going through hardship and they don't know where to go to get the resources. We are not even talking about mental health itself, but what that can create if somebody is hungry and they don't know where to go to get food. Or what can we say when somebody thinks that they are working for $15, $17 an hour and they cannot even afford to pay their bills, and that's created trauma where they are all the time thinking about what's next and they don't know the resources available. And then when we move forward to when people are in that situation of mental health or whatever, anxiety or whatever they have, where can they go to get the resources or to get the treatment they need? So I think we can layer that in 4 or 5.
Nicole, did you want to answer that question, and I'll go after you. Thank you.
Sure. So when we think about developmental trauma, it can typically happen in early childhood, in which a child experiences neglect or abuse. Things that happen because of developmental trauma can be hopelessness, despair, deep-seated levels of shame. When a child is little, they attune to their parents and something happens called mirror neurons. And there's been a lot of really fascinating studies about those. And if those are not present, there can be levels of developmental trauma. The difference between that and racial trauma is that depending on a child's background or family, right, and exposure, depending on where they're born, depending on community, racial trauma tends to be on the outside, not necessarily within the family unit, within the community. People who experience racism do not necessarily have to live with a deep-seated sense of shame or experience hopelessness. And so there is a certain difference where we can think of racial trauma as something external and environmental, depending on the family unit, is where as we can think of developmental trauma that might be happening in infancy through childhood, that can happen within the caregiving system of the child. It does not mean, though, that children of color are not more likely to experience developmental trauma due to their experiences in the context in which they live.
And I was going to add that developmental trauma is just the way it's defined, and once like those adversities, once a person is an adult, they're not going to have childhood adversities. It's going to be, you know, adult adversities. But for racism, microaggressions, they could continue throughout the lifespan, so that there is really there's not an end to it. So once a child becomes an adult, it's not considered, their experiences no longer compound those adversities in childhood for the definition of developmental trauma, but for racism and microaggressions, they continue to compound. I hope that makes sense. It's so hard to define some of these.
Yeah, I think it's because this is all what I'm hearing from everybody's intersectionality all around. It's really, you don't do it point. And in fact, the question about trauma that's left on the child too is somebody saying they have 6 children that between 19 and 5, multiracial, and were adopted from the foster care. They don't seem to notice yet the microaggressions happening around that, but the person does. So, but they've seen a lot of trauma in their lives. So in your opinions, will it be better to point out these microaggressions or let them not realize this later on? I mean, and the foster care issue is important because 45% of children are in the foster care system are children of color.
For
So
that specific question, trauma is the experience of the event. So it would be something that they probably would have to identify as it's a problem to them. You can definitely have conversations about those things, but it is, again, trauma is an experience, not the event. So different people can experience the same event differently.
but the question is it for them to say, hey, can we stop this right now, or to wait for them to realize later on that they are going through microaggression or any other situation that can happen? I think we talked about it earlier when we talked about the educational piece of it. We all have a responsibility here. When we see something, we say in America, we say something. Even if it's not those children that sees it or that recognize it, the society or those people around it that sees it and recognize it should say something. I don't think it's okay to leave anything go unnoticed when you see it and you know that it's not okay.
Yeah. So I think we're going to move, and I think just following and Ali mentioned this earlier, I want us to maybe perhaps talk about a second and third combined. So we heard trauma being one of the huge barriers of access of care, right? So we do know that people are less likely to go, but there's, there are common barriers like mental health care, insurance, prejudice, again, discrimination, structural barriers, even transportation, for instance. We know that racial and ethnic minorities are definitely disproportionately affected for the lack of quality health care, insurance, linguistic, cultural responsible care, and more than 80% of Black Americans are very concerned about the stigma associated with mental illness, and that discourages In addition to that barrier, I think Ali mentioned early, we have to understand, we start with Black communities. 40% of the homeless population is on the Black community, are Black members of the Black community. 50% of people incarcerated are from that community, and 45% of children, as just mentioned. So this access to care and the barriers, because I think I heard Ali talking about the barriers, and how we can start unfolding those barriers and removing those barriers, because they are, educational barriers, housing, employment, even worshiping, as we were hearing from Ali. Any of the panelists can answer. So
That is what I'd like to say, a wicked complex problem, because it's layer after layer after layer of things. And there is so much work to be done on, again, so many levels. One is education on bias and implicit bias in schools, in police departments, in justice systems, in every system that we have, medical system, to be able to provide services, education in a way that is not biased and discriminatory. And we can't deny those bias and discriminations based on the numbers that you just said. So having more empathy, more just curiosity, and being able to, I mean, we do know that we have a, school to prison pipeline where kids are getting more in trouble. Kids of color are getting in trouble with higher, disciplinary measures than their white counterparts. So for being able to, have any semblance of equity, of, parity, we need to start with education on the educators, on their biases and implicit, even biases that they're not aware of, to be able to stop this and maybe ask a few questions, to be able to better understand what's going on in those students' lives, like they do for other students. I think that's one place to start, providing services and not being so punitive from the beginning, so that kids have better opportunities for success. And then we can change those numbers going on, later on.
I think if we look at it on different systemic levels, and yes, it's incredibly complex. I think we have to look at also what our own social responsibility is when we look at things like laws that go into effect, like happened here in New Hampshire, divisive concepts where we're being told it's not legal to acknowledge the difference in other people's, that there's really, there's no such thing as different levels of power, privilege, and access. And so we have to think about, well, when we're self-examining, what are we supporting, what are we feeding, and what are we fueling? I agree in the education level. I kind of worry, I'm a little bit different about bias and implicit bias training. It's important to understand what bias and implicit bias is, but what studies have found is that when sometimes someone goes under, they take a training, they're like, oh, well, I took a training and now I don't struggle with having any implicit bias because I just checked a box. And so I think what's really important is to be self-examining and have other people to reflect back to us in community to check, so we can check ourselves, and so we can be reflective with ourselves and have others reflect with us. I think having access to care is extremely hard. That's why I started Therapists of Color New England, so people can find a place to have therapists that look like them. Part of the challenge, though, for me is to start a practice is finding practitioners to hire. Why? It's the same challenge that I faced, is because becoming a therapist or having access to higher levels of education is extremely costly. extremely costly. So when I was in grad school, there was two classes of people. There's really a very little middle class. It was either the wealthy that could pay for the care outright, or those of us who had to take on exorbitant student loans to be able to go to school. And so I think that's another piece of it, is really access to training. We don't have a lot of providers because a lot of providers can't afford to go to school. And nationally, statistics show that only 4% of providers nationally are either AAPI or BIPOC. So there is a huge shortage because we don't all have access to higher education.
To just build on what Nicole and Lisa said, I think Lisa covered part of the youth and then going through the younger generation and the education from the start. And I think every community, that's like a foundation of a community, the basic education from, I don't know, 4 years old to when they are 18 to move on to college. I think every society that we've seen have been successful, we talk about education. And when it comes to these issues that we are talking about, we know many of our community's members, even though they went through a training, where it's harder is people don't even recognize there is an issue. And when you don't recognize there is an issue, how can you try to find a solution for that issue? And I'm going to build on that when it comes to employment and then housing. Many people of color today, if they want to apply for housing, even to rent, they struggle based on a community. They say, oh, this community, it's not for Black people, or this community, it's not for poor people in general. What type of community is a Black community or a white community or a rich community? If you can afford to be there, the affordability is key here. But to make that happen also, I hear many people saying, specifically in our community, when they are on housing support or whatever, they will say the scrutiny they go through, even if you want to be part of it, you can't because it's just too much. And they ask themselves, is it because they are immigrant or because they are Black that they go through this entire scrutiny? Or it's just because they are considered people that are asking for help that maybe might not need the help. So I think availability and accessibility is key here in this context. And then based on the statistics that we just shared or you just shared, I think that itself educate us that there is an issue here and there is an important, it's important for us to address that issue and to educate anybody to understand that these issues cannot be resolved unless we talk about them and unless that people are open to hear about them. Those conversations are not easy conversation and they are not easy to hear, but they are important conversation to do. There is an organization, a housing organization now that do a testing where they send white people to go ask for a housing and then they send the Black people to go look for a rental because people are thinking they're discriminated, they cannot get a rental properly. So all those issues that are facing our community, I think need to be first talked about, but also secondly, people need to recognize that there is an issue where we can address them. Employment is the same thing. You can go have a master's degree or a PhD if you are different because people feel comfortable hiring people like them that looks and sound like them than to hire somebody that is different because they might think, okay, it's going to be a conflict. We won't see eye to eye. As a leader, why do you need to see eye to eye? Why can you not hire somebody that can challenge you every day to do better? Thank you.
Well, thank you so much. There's so much to unpack that I'm really one of the things I'm mindful of the time. And I think one of the things when we start this is the kind of conversations we need. We're not going to solve this issue without a conversation like this, right? And I think each of the presenters, and it's been my experience too, that this is exactly what we need to have these spaces. So as a way, the fact that NAMI is putting this together is a huge step, because that means that okay, let's all just be allies on this work. This is just not only the responsibility of people of color. We all need to be together. And this is a life journey, I think, at least it's been for me. I think for me to start dedicating my life to do this work. So I know I put some resources that we offer, but I really want to, for us and each of the presenters really to start thinking, so what do we do now? Like what, because I know that there is resources at the state level. We know there is an issue, but what's important that everybody here on this call and this conversation is interested in doing something about it, right? And everybody's gonna be in different spaces. So what are the resources on your states? We definitely have in the New England Mental Health TTC, I put lots of resources. We have learning communities on these topics, but I think we want to know how can we help, what you would like to do and continue. And please invite all of the panelists to provide resources and see how we can all continue the conversation and the effort. It has to become intentional in order to start working. So
wow, I think you summarized it. You made a conclusion here, because when you say it's everybody's responsibility, you said it all. And I'm going to take this opportunity to say what NAMI is doing is where it all can start. We have to visit the communities and create a platform where people can talk about it and people can visit each other to know and create a representation. Because I say to people all the time, because I'm Black, doesn't mean if you have one Black person on your team or on your board or whatever, you cover the all Black. No, I'm a Black, but I'm Muslim. I'm a Black, but I'm an immigrant. I'm a Black, but I speak French. What can we do to make sure that the representations are there, even though we are talking about color here, because many people, when they talk about diversity, they only see the color part of it. But diversity, I can wear 4 or 5 hats of diversity as a Muslim person, as an immigrant, as a young educated, as whatever you can call it. But at the end of the day, to have a mindset that this is a responsibility, that it's my responsibility, it's everybody's responsibility, and let meet people where they are at, not just sit in the offices and talk about it. We have to be out there in the community, meet the community leaders, and create a platform where people will talk about it and feel comfortable talking about it and share those resources that are available for everyone. Thank you.
I'd like to add to that, and I touched upon this earlier. I think that we are all a part of it. It's just not the responsibility for people of color to be the ones who are undertaking this, but I think it's important that we do self-evaluation and we look at where our power is, we look at where our privilege is, and we also look like where we might be oppressed and marginalized. And so that could be looking at our age, right? And so we know that children and elderly have less rights, looking at our race, looking at our gender, our sexual status, our sexuality, whether we have abilities or disabilities, and our education level, our socioeconomic status. And wherever we might have power is where we also have influence. And so it's really taking that self-inventory and saying, I have power and influence here. How can I use that to help other people who might have less access to power? How can I use that to advocate? And how can I use my power and my privilege to really help and be responsible to the community in which I live?
Kind of on what Nicole and Ali were saying, one of the things too we have to recognize is that when we all have access, it doesn't diminish the access of other people. And I think that's a misconception, that when one group gets more access, other groups get less access. We all deserve the equal access to services. So that's one important mind shift or thought shift. And I think many communities are working on different things to increase visibility and increase representation, as well as just having more conversations. So one of the things we're working on in Nashua, we developed a podcast, which I think Maria talked a little bit about in my intro. It's called Speaking Our Minds. It's in all about mental health in 5 different languages. So we talk about it not only in people's native language, but also in the context of their culture. So I will definitely send Troy a link to that. We're just starting season 2, where we want to have more community members talking about their experiences with access to mental health and just mental health in general as a topic, because there is a lot of stigma out in our communities about mental health and about accessing services, and what does that mean. And we can't forget all the medical trauma that our communities have experienced, where treatments have been done to people without consent. And that harms their ability to access. That's a big barrier that we have to talk about, because that is just not going to be erased. Those things happened, and we have to think, know that they happened to make sure that they don't happen again, and create more trust within our medical communities, our mental health communities, and our constituents, our citizens, our patients, our community members. So that's also a big part of it.
I think talking about stigma here, and if we can address the cultural stigma, because each culture sees mental health differently as well. Somebody that grew up in Africa that is Muslim and moved to the United States might define it differently than somebody who was born here, even if they were from Africa or they are Muslim. Because the cultural stigma on how people see things, or when they go through to find resources where they say, oh no, it's not easy to find them. I think that's another very important topic to talk about when it comes to stigma and cultural stigma.
Okay, so I think you're hearing some good resources there that everybody perhaps, and I'm not sure, probably will just turn it over to NAMI again. We as the New England Mental Health TTC, we are one of the national centers. We are here to provide services in New England. We provide free training and technical assistance, and we partner with all of the communities in New England to really have not only presenters. So we have developed a lot of information, but more importantly, we like to have these kinds of conversations. So please use us as a resource, and clearly through NAMI in collaboration, in partnership. This is something that our grant, which is funded by SAMHSA, can provide in terms of building different communities and conversations. But this is a national network that offers a lot of opportunities and free resources. Just keep that in mind. In terms, one of the things as we see this is there are internal efforts and external. So, and I think that's Nicole talked a lot about. It's the piece that we all need to be aware and becoming ourselves. I know, at least for me, doing this kind of work, facilitating these conversations, it has to start from me, right? We all need to be, because I, like the panelists, being in the position to be the only Latina, the only person. And again, I can only speak as me, myself, as a Colombian, in my experience, as Ali said about his experience. So there's an internal component to all of this, but there's also the external work and connecting and doing this. The feeling of a loneliness is a very hard feeling. And I think the more community we can build around these issues, the more important. So I'm just going to turn it over to, again, to, I don't know if it's Susan for next steps. And NAMI, I want to thank everybody really for having this privilege to be part of this amazing panelists today. So I don't know who's gonna turn it. I'm gonna put my email too as well. Would love to continue conversations like this, but Susan?
All right. Thank you, Maria. And truly, thank you to all of our panelists today. We are truly grateful to you for sharing of your time and your wisdom and your lived experience. Those stories of lived experience are always tremendously powerful, as we know here at NAMI New Hampshire. And while July and thus Bebe Moore Campbell Minority Mental Health Awareness Month may be coming to an end, this conversation around BIPOC, AAPI, Latinx mental health still continues. It is everyone's responsibility to take this heightened awareness, these wonderful insights and information we have gathered today, but we all have a responsibility to turn that into compassionate action all year long and create meaningful systems change. So please, I hope everyone comes away from this with a charge to learn more and do more in this space. I would remind folks that here at NAMI New Hampshire, we do offer a variety of resources to folks across the lifespan and from all different backgrounds. We have support groups that you can access free of charge, many of which are offered virtually. There's some in person, but if you have trouble in terms of travel, we have the opportunity for you to access support groups virtually. We have support groups for families who have adult loved ones living with mental illness. We have support groups for parents and caregivers of kiddos with serious mental health challenges. We have support groups for adults who are living themselves with mental illnesses that are facilitated by their peers. And we also have support groups for survivors of suicide loss. We offer some really unique opportunities to access support through our online Facebook support groups, which are closed groups and moderated. You can check all of that out on our website. I'd also remind folks that we do have our NAMI signature education programs, family to family, NAMI basics, peer-to-peer. Please check out our website again in the fall. We have a number of sessions already scheduled. You can check it out, find out when they're coming up, reach out and get your name on a list. Again, those are offered free of charge. This fall, we are also offering our It's Your Move advocacy training, so that if you want to get out there and advocate for systems change and to help create a more equitable and more healthy New Hampshire, we're happy to have you participate in our It's Your Move training, and please, sign up for our e-news and our public policy alerts. And we will make sure that you are informed in terms of things that are coming forward in the next legislative session so that you can weigh in with your legislators. I would also mention that our Connect Suicide Prevention and Postvention team remains available to help provide folks with support as they may need it. And we can also do training for people around our state. So again, truly grateful to all of our wonderful panelists. It was really good to see you all today. And thank you to the folks who joined us. You should receive a link to the recording for today's webinar, along with the resources that were discussed today. So please keep an eye out for that and reach out to us if you need any assistance. We're happy to help you do systems navigation. And if you have thoughts and ideas for future webinars, we'd love to hear them. Looking forward to working with all of you. Thank you all so much. Take good care, folks.